This video aims to provide an overview of the Ward AO responsibilities around the Electronic Discharge Summary System. The Electronic Discharge Summary System, or EDS, is a computerized patient discharge summary which imports information automatically from various Queensland Health source systems such as IEMR, ELMS, AusLab and Hibiscus. Doctors on the ward will be required to complete their discharge summaries in EDS close to or after the patient's discharge from the ward. To assist the process as much as possible, the following are the Ward AO's responsibilities: creating or starting an EDS for patients on the ward, ensuring patient and GP details in Hibiscus are current and up to date, and distributing copies, for instance mailing out or faxing as identified on the distribution report. To log into EDS, double-click on the EDS icon on your desktop. Your logon is your Novell username and password. To look up a patient, select your facility from the Facility drop-down menu and input the patient's UR in the URN search field. The selected patient's admissions will show along the left-hand side in reverse chronological order, with the current or most recent inpatient admission on the top. The EDS status, for instance, not started, finalised or interim, will also show. If it states interim, it means another staff member has started the EDS process for this patient. This is expected if the patient has come to your ward from another ward. However, if it states not started, like in this case, you will have to create the EDS and begin that process for the doctors. This is done by clicking the icon of the blank page with the green plus symbol. The icon will change to a page with a pencil and the status will now say interim. Reports can be run to provide doctors with information on the patients whose enterprise discharge summaries are yet to be finalised. From within EDS, click on Search from the EDS home bar. Various search fields will display. Select your facility from the drop-down menu and make sure Discharge is selected. Input a nominated from and to date. And put in the consultant's name whose outstanding discharge summaries you want to bring up. Choose the applicable status, in this instance interim, and any unit that might be relevant for this doctor. Click on Search and it will load the patients whose discharge summaries are currently outstanding. Print as needed using the print icon in the top right hand corner. Take note if it goes over several pages because you will need to print each page. Once the doctor has finalised and printed off the completed discharge summaries, this will be accompanied by a distribution report. This outlines who, where and how copies are to be distributed. For instance, fax a copy to the GP, mail a copy to a patient, send copy for scanning into the patient's IMR. If discharge summaries have been sent electronically, this will be default ticked by EDS. Tick off as other copies are distributed as per the distribution report and sign off at the bottom of the page. This has been an overview of the Ward AO responsibilities around the Electronic Discharge Summary System.